Do you feel dizzy? An informative presentation on syncope and postural dizziness. Syncope. In the medical field, syncope refers to a temporary loss of consciousness caused by a drop in blood pressure, or otherwise more commonly known as fainting. Postural dizziness. Postural dizziness is caused by orthostatic hypotension, aka low blood pressure that occurs when one sits or stands up. In the picture on the slide, some symptoms of the vagal response are listed: dizziness or lightheadedness, turning pale, sweating, blurred or tunnel vision, nausea, fainting, skin feeling cold or clammy, feeling warm, and ringing in the ears are all symptoms of the vagal response. There are 4 classifications of syncope. There are the mediated/reflex, cardiac, orthostatic, and neurocardiogenic. To begin, the mediated/reflex syncope we will be discussing. This type of syncope results in the dysfunction of the autonomic nervous system. The autonomic nervous system regulates and controls blood pressure and heart rate. Symptoms include dizziness, visual disturbances, hearing disturbances, and blackouts. Your blood pressure and heart rate can lower, which reduces the blood and oxygen supply to the brain, which leads to syncope. Over here in this picture, there is a list of things that you should know about the vasovagal syncope. Vasovagal syncope is due to a fainting spell that's caused by a sudden dilation of blood cells in the legs. See a doctor if the condition reoccurs. If you feel like you're going to faint, you may be able to help prevent the blackout by sitting down with your legs elevated. Triggers may include getting blood drawn and being exposed to a traumatic sight or event. Vasovagal syncope almost always occurs when the victim is standing or sitting upright. Cardiac syncope. Cardiac syncope is a quick loss of consciousness from a few seconds to a few minutes. Cardiac syncope has a fast onset and a fast, spontaneous recovery. Cardiac syncope is caused by a decreased blood flow to the brain. The heart cannot supply enough blood and oxygen to the brain. Over here are some visuals of the heart pumping blood into the brain. When cardiac syncope occurs, the heart cannot supply enough blood to the brain. Orthostatic syncope. Orthostatic syncope can occur suddenly with no warning or could have some warning signs. There is a reduction of blood flow to the brain, or not enough blood in the brain. Orthostatic hypotension describes a decrease in blood pressure within 3 minutes of standing or being upright at 60 degrees. Orthostatic syncope is a result of postural decrease in blood pressure. Neurocardiogenic syncope. Neurologic syncope is caused by a neurological condition such as a stroke or a seizure. There is a miscommunication between the heart, blood vessels in the lower extremities, and the brain. Below is a visual of how the blood is pooling in the lower extremities and not enough blood is going into the brain, which will lead to a neurocardiogenic syncope. Common symptoms of syncope: pale skin, feeling lightheaded and/or dizzy, tunnel vision, which is when your visual field narrows so you can only see what is directly in front of you, nausea, clamminess and/or sweating, and blurred vision. Over here are some pictures of examples of blurred vision and tunnel vision. What are some warning signs of syncope? Please consider what you would expect to feel before you fainted. So some warning signs of syncope are dizziness, faintness, and nausea, as pictured below. Risk factors of syncope. Syncope, or otherwise known as fainting, is common, but adults over the age of 80 are at a greater risk. People who are male, age 60 or older, have a presence of heart disease or a history of fainting are more at risk for cardiac syncope. Other risk factors include cardiovascular disease. The incidence rate among participants with cardiovascular disease was almost twice that of participants without cardiovascular disease. Other risk factors include a history of a stroke, a history of TIAs, or a history of hypertension. Additional risk factors include a low BMI, increased alcohol intake, and diabetes. Risk factors, medications. Any medication affecting your blood pressure and/or treating heart arrhythmias puts you at risk for syncope. To begin, diuretics, or otherwise known as water pills, increase your urine production, which causes a decrease in blood pressure. Lasix, Bumex, Demodex, and Microzide are all examples of some diuretics. Next, we have nitrates. Nitrates relieve chest pain and symptoms of heart failure. Nitroglycerin, nitroprusside, and dilatrate are all examples of nitrates. Next are vasodilators. Vasodilators dilate your blood vessels, which causes a lowering of blood pressure and increases your blood flow. Prinavil, Zestril, Monopril, and more are all vasodilators. Next, there's phenothiazines. Phenothiazines decrease hallucinations and delusions. Thorazine and Compazine are examples of phenothiazines. And lastly, there are antihypertensives. Antihypertensives decrease your blood pressure. Lopressor, Toprol XL, Cardizem, and Cozar are all examples of antihypertensives. Prevent falling. How to prevent a fall. Monitor your blood pressure. Ask your provider questions about medications that you have been prescribed, such as antihypertensives and diuretics, and know the warning signs for syncope. How to prevent dizziness. Get up slowly after lying down or sitting. Slowly sit up at the edge of the bed for a few minutes. Slowly stand up, but sit back down at any moment if you are feeling dizzy again. Wear special compression stockings to keep the blood from pooling in your legs. Add salt to your diet if advised by your provider. Do not skip meals. Eat up to 6 small meals a day. Do not stand for long. Shift your weight over your legs while standing. Drink water frequently, especially when exercising or out in the heat. Monitor blood pressure. Do not drink coffee or caffeine. And discuss with your provider. Discuss your medications, both prescription and non-prescription. Non-prescription includes herbs and teas, as they all play a role in your blood pressure and can lead to syncope if not taken correctly. In this slide, there are some pictures of examples of how to prevent syncope. So using a walking device such as a cane or a walker adequately, drinking enough water and maintaining hydration, using compression stockings, which helps the blood flow, and maintaining an optimal diet and good nutrition all help prevent syncope from occurring. Recommendations for syncope. Individuals who begin to experience warning signs of syncope, such as fainting or dizziness, should lie down. The individual should get an EKG done. An EKG is a line graph that shows the electrical activity of the heart. If the individual's heart is too slow, or if there is an arrhythmia, such as atrial fibrillation, this can cause syncope. These heart conditions can decrease blood pressure and ultimately decrease blood flow to the brain, which can cause syncope. Make sure you are staying hydrated. Getting adequate nutrition can be beneficial to reduce the risk of syncope. Increase your salt and fluid intake in moderation. Take careful precautions in those with diabetes or hypertension. Talk to your provider about the medications you are on. Frequently check your blood pressure. And most importantly, know the warning signs for syncope. Recommendations for syncope continued. Exercise. Try standing up and walking around or walk down the hall to get your blood flow moving. Also, try exercises such as kicking your legs and raising your arms to get the blood flow moving. Let's try it out now.
For our next one, we're going to stretch out our hamstrings. So the first thing we want to do is walk our hips up to the edge of the chair. Get all the way on the edge. Good. You got it? That's it. Now we're going to extend that right leg out. So you want to be on the edge of the chair, extending that right leg out. You want to rest it on the floor. Good. Take your right hand and slide that right hand down your leg as far as you can towards your toes. Good. And we're stretching out that hamstring. Good job. Stretch out that hamstring. A nice stretch. Good. And then we'll come back up. Sit nice and tall. Lift your ribs. Good. Now you want to bring those toes back towards your body. Good. Bring those toes back and you're going to feel a stretch right at your calf muscle. Good. Bring those toes back. Can you feel that stretch? Good. And bring that leg in. That's it. Now we're going to extend our left leg out. Good. Sitting on the edge of the chair. Now we're going to extend that leg, extend that arm down as far as you can. And feel that stretch. Good. You feel that stretch on that left side? Good. And we're going to come back up. Good. Now you want to bring your toes back towards your body. Sit nice and tall. Good. Nice and tall. Feel that stretch in our calf muscle. And bring that leg back up and relax. Good. Roll those shoulders around 3 times. Take a nice breath in and out. Good job.
Make sure to always notify your doctor if you are experiencing symptoms of syncope. Thank you.